Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need. Marjorie, are there any other drugs other than tetracycline that cause enamel hyperplasia? And if they receive these drugs after 12 weeks, is it less likely to affect the enamel? Yes and yes. The recommendation for tetracycline administration or tetracycline-like compounds like doxycycline would be don't administer in puppies that are, in mothers or puppies that are nursing 6 months or less. So if the puppies are nursing, and that's just a general guideline so people can use that, it's not specific, but if you have puppies that are still nursing, the mother should not have tetracycline because 6 months or less is what they say. It's more of then a blood thing where the tetracycline gets into the tooth root to innervate the pulp from the blood supply and discolors the tooth in the 6 months or less thing. But depends on when the mother stops nursing. But in puppies, for sure, 6 months or less, and maybe even longer to avoid that. But 6 months is a good guideline to go by to avoid that. From a tetracycline standpoint, fluoride is the other component. Fluorosis is another component. So fluoride ingestion would be a situation where that's the case, but that's not something that's common. Tetracycline would be fairly common in some cases. So hope that answers your question. I occasionally have patients with individual stained teeth that I can't get the stain out of. So that's one question. And there are a lot of situations where you're not going to be able to get the stain out of, not just from the actual imbrication of porphyrins from the saliva into the diseased dentin or enamel, unless the enamel is removed or it is diseased visibly, and you can go down and remove some of it and it takes it off, that's fine. But if it goes deep, you don't want to really remove it. If it's getting to more of a tooth structure that's normal tooth structure, or you can just have staining from other things that's intrinsic in the enamel that is from a less than ideal surface that's maybe a little porous, but doesn't have defects in the enamel that you can't remove. Wear is a good example of that. Chronic wear can produce changes in the enamel character and color, but you can't remove that. Look at cage chewers. Those are maybe an exception because that's more of an acute thing, and that back part of that tooth, you can remove it, but you have to go down into the enamel a little bit with a diamond football burr or an aluminum oxide or white stone burr to get down in there to remove that. And we generally don't recommend that in general practice. So the stain, if it's to answer it clinically, if you have a case where you have staining of enamel, if you are cleaning and you can't get that stain out, it's probably not something you want to address. It's probably something that's going to be an intrinsic staining that if you try to remove it, you're going to be causing harm. So intrinsic staining in what otherwise looks like normal enamel is not something that you even want to approach clinically. Stephanie asked, how commonly do we see that? Can it affect cats too? Yes, it can. We don't see it real often. And I don't know if that's because it's not detected, if it's not being referred. We see maybe a case every week, and we might do 40 cases a week or more. So a case a week, not real common for us on a referral basis. We see of those, let's say 40 cases, 30 of those are perio, 25 of those are perio, even on a referral basis, to put it in perspective. Do products like Healthy Mouth help? They help in cases where, as Wendy asked, if they decline treatment, probably more than you would know. They decrease the bacterial colonization, the inflammation, and certainly would help in theory for decreasing the chance of that dent to be compromised before we can possibly get tertiary dentin formation in those defects, which can occur and sometimes does in these, as evidenced by the fact that we see these sometimes down the road and they're okay. So brushing obviously is the best, but things like Healthy Mouth, Orvet Chews, things that are VOHC approved, can certainly help from a plaque standpoint. Any of those things on vohc.org can help with that in theory. Mark, a little bit more advanced question, and I'll answer this for you and for those who are doing composites that have had training, because it's a quick answer. I use Fluid ALC as a composite, which is from Pintron, and ALC means accelerated light cure, and what that means is that it can be cured with your light in 5 seconds, and huge time saver versus the 20 seconds or more that some of the older generations and even some of the newer generation composites require. So the accelerated light cure allows that to happen. And we do, to answer your question further, we do 1 millimeter increments. 2 millimeters is max, 1 millimeter increments in layers, light cure for 5 seconds, add additional layers. And Heather, for the last question in this case and the last question for the day, are there other treatment options for clients who can't afford a specialist? And cleaning really well, polishing these teeth on a regular basis, home care like we've discussed, all those things may allow for time to allow for tertiary dentin formation by the body, which is probably a couple months or weeks to happen. And then once that happens, then you get sealing, and as long as there's not bacteria sealed within that, then we may be okay. So yes, those are options, and follow them radiographically down the road, 18 months at the longest, and if there are changes that suggest those teeth are dead, extract. So that's the way to approach those. I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.